Hey, what's up and welcome to 90 Day Super GP, brought to you by PowerUp Endo. This is the game-changing GP training that you've been looking for so you can power up your endo game and perform more endodontics in your practice. I'm Dr. Granados. Let's get going. My expectation is to give you a backstage pass in endodontics and for you to receive the most clinically relevant information out there so you can become more successful and thrive professionally en route to becoming a super GP. I'm going to break it down for you in a super easy and relatable manner so you can understand a curated framework of endodontics in an easy to digest format. I promised you I will not waste your time, and so while 90 Day Super GP is by no means shallow in depth, it is evidence-based. I have a very strong background in the endo literature, and I'm not going to bog you down in the minutia. I'm just going to give you exactly what you need so you can hit the ground running and thrive professionally. 90 Day Super GP is really intended for the ambitious general dentist that is looking to make a splash and start incorporating many, if not most of their endo cases in their practice. The results that you are going to obtain are a rich understanding of endodontics so you can implement these systems that I have put together for you ASAP, like tomorrow. It's really going to be facilitating your transformation into a super GP. This program is not intended to be a stuffy educational course. It's going to be laid back, fun, engaging, and is really organized for the busy GP in mind so you can grasp the concepts in digestible chunks. PowerUp Endo's 90 Day Super GP is broken down into clinically relevant lectures and hand-selected live case demonstrations. These are cases that I get every day as a busy endodontist. Oftentimes, these cases require so little mental energy, and with some confidence and training, you can handle these cases, and I'm going to show you exactly how. I've also put together some valuable bonuses that are really going to give you a quantum leap in understanding endo. Additionally, you're going to find extremely clinically relevant downloadable resources so you can have them on hand for quick reference if needed. Most GPs on average refer out 8 to 10 cases per month. This represents a significant lost opportunity to capture revenues for your practice and thus your pocket. Honestly, oftentimes this is just due to a lack of training and confidence. There's nothing particularly special about endodontists or any other dental specialist other than we have obtained the knowledge, the frameworks, and the confidence to handle these cases, and we know what to look for. That's what I'm here to do for you. You can do this, I know you can. In terms of the gaps in knowledge in these specialty disciplines, it's really due to knowledge hoarding. I remember being a dental student and having entire courses on specialty disciplines only to move on from a semester's worth of material with minimal clinical applications ready to implement. For example, I remember very clearly having a whole course on orthodontics. I went through an entire semester learning about all the types of movements, appliances, brackets, but never once did we place a bracket on a tooth, natural or plastic, and we all know why. It's because they don't want us to understand orthodontics because they don't want us performing orthodontics. They want all that work going to orthodontists. There are lots of self-interests and conflicts of interest at play in terms of teaching GPs about specialty areas of dentistry, and I'm hoping to change that. Same as when you go to your local study club and your endodontist, for instance, is giving you a presentation on their most complicated cases, crazy retreatments, and molar microsurgery. I do all that stuff too, but that's the minority of my practice. Most of the bread and butter cases is stuff you can handle. You just need the mentorship and coaching, and that's what I'm here to do for you. Endodontics is unbelievably safe and successful, especially when you compare it to other medical procedures. Salarabi in 2004 performed the landmark study where they looked at dental insurance data and were able to compile information on 1.4 million endodontically treated teeth. They followed up these cases for a minimum of 8 years. Basically, by determining that no extraction had been performed on those same teeth, they were able to calculate that there was a 97% retention rate. Now that number relates to the survival rate of these teeth and not necessarily the success rate, because some of these patients could have had asymptomatic issues, but survival rate is how implant studies are generally reported in the literature, so that you get an idea apples to apples. Also, of the 3% of the teeth that were extracted, it's really important to remember that 85% of them had not received coronal coverage. So if you think about it, that tells us that the majority of those teeth that were lost may have been lost due to restorative failures as opposed to endodontic failures. There are reasons for that mechanism, but big picture, it's really important to realize that endodontics is incredibly safe and successful. This study didn't even delineate if the endodontic treatment was performed by endodontists or general dentists. Anyways, it's a really great study and it's cited a ton in the literature. Power Up Endo's 90-Day Super GP is organized in an online training platform that is unbelievably intuitive and user-friendly, and I'm excited to be utilizing it to facilitate student navigation through the training content. I know you're going to appreciate its simplicity and ease of use. Again, I'm Dr. Granados. I went to the Boston University Goldman School of Dental Medicine for my pre-doc training, and then I did a combined certificate and master's program in endodontics at the University of Connecticut. My research on conservative endodontic access preparations was published in 2018, and I have been in private practice since graduating. Also, I served in the Massachusetts Army National Guard for 10 years, where most recently I was activated in March 2020 in response to the COVID-19 crisis in the really scary early days of the pandemic. I was responsible for performing nasopharyngeal COVID tests in countless elderly facilities on suspected positive patients, as well as training non-medical soldiers on how to perform these same diagnostic tests. To me, that was the capstone of my military career, and I'm very, very proud of the work that we did. Anyways, this program is not about me, it's about you and your transformation. The look and feel of the program is really spawned out of how I would explain to friends and family what I do day in and day out. I would frequently describe it as being similar to playing video games while you were using all this fun tech and working in such a small space, trying to get the internal aspect of the roots cleaned and filled. I really wanted to build on that idea by presenting endodontics in a gamified way. Also, I decided to present the content utilizing the power of the internet so I could reach the most amount of people and hopefully do my part in raising the bar in how endodontics is performed in the general practice. This program is organized into clinically relevant worlds and bonuses. World 1 is your welcome to the program, as well as an overview into the Power Up Endo method. World 2 will be going through an upper anterior live case demo and covering endodontic diagnosis. In World 3, we'll treat a single-rooted premolar and take a deep dive into the Power Up Endo method. There, I'll walk you through a systematic way on how I want you to handle every single endodontic case, regardless of its complexity. In World 4, you'll see a 2-rooted premolar live case demo, and then I'm going to show you all the instruments and supplies that you'll need to perform efficient endo treatment in your practice, as well as how to set up your operatory. In World 5, we'll go over a lower molar live case demo and cover what I like to call bulletproof anesthesia. This is a universal skill that I want you to use for not just your endo cases, but potentially all your dental procedures. In World 6, we'll perform a 2-visit lower molar live case demo, and then we'll cover radiography and endodontics. In World 7, you'll see a crown-prepared lower molar live case demo, and I'll show you how to achieve airtight rubber dam isolation. Then in World 8, we'll treat an upper molar without an MB2, and then go over antibiotics, complications, and post-op pain. And finally, in World 9, we'll go over an upper molar with MB2 in terms of a live case demo, and we'll discuss when to refer. I've also included a value-packed bonus stack for you. In bonus 1, we'll go through an emergency visit live case demo and cover how to relieve endodontic pain on a time crunch. In bonus 2, I'll explain all the things you'll want to consider when deciding on 1-visit versus 2-visit endo treatment. In bonus 3, we'll go over coding and we'll discuss how to maximize revenue and reimbursement. In bonus 4, you'll learn how I think you should schedule all your endo cases. Then in bonus 5, you'll learn about various file systems, and we'll discuss how you may want to decide which system you want to incorporate into your practice. So that's it for the program intro, and I'm super excited that you're investing in your education and your professional development. I'll see you in the next lesson.